I begin the show tonight with a warning, a life and death warning. At a time when the dread of a pandemic seems to have been replaced by a general complacency, it could have dreadful consequences for all of us. First, a warning from the World Health Organization. It says the COVID pandemic is not over. Fresh waves of the Wuhan virus are sweeping through China, and they have put the world in peril yet again. And guess who has issued this warning? The one and only Dr. Tedros, the chief of the global health body, once accused of being too China-friendly. Let me now directly get to what he has said. I'm quoting. We have come a long way in bringing the pandemic under control, and we are in a much better position, but the pandemic is still not over. 10,000 people are dying from the virus every week. The warning may be aimed at the world, but we all know which country is responsible for the return of the angel of death? The country which gave us this virus in the first place. China. Its lethal wave could soon spill over if we continue to remain complacent. On the show, we've been discussing the predictions. We've been talking about the projections. We've been deconstructing the numbers. But tonight, I want to take you through some videos. Videos that China will never show you. They tell you the true scale of this surge. The first one is this one from Sichuan. It shows the moment a doctor suddenly falls unconscious and lies slumped on his chair as his colleagues rush to help. Watch this. You saw that. This only tells you the kind of strain that China's healthcare system is working under currently, where doctors are unable to bear the workload. And if you think that's bad, then watch this now. It's from an ICU in Chongqing, where patients are lying on the floor, receiving CPR from automated machines with a group of doctors huddled nearby. Then we have this video. It's from an emergency room in Tianjin. Just look at the number of people present. It's a completely packed room with some people attending the patients themselves. China is absolutely mum about these images. It has neither refuted them nor confirmed their veracity. Why would it? It's been more than 3 years, multiple waves of this virus, and not once has the Chinese government admitted the truth. The kind of hardships that people have gone through. In fact, on the contrary, it has covered up the pain and havoc with propaganda. And that's exactly what it's doing now, 3 years later. Look at this headline. On December 20th, that was Tuesday. China says not a single person died. Ironically, it said this right after changing the criteria for COVID deaths. We told you about this yesterday. China is only recording deaths due to respiratory failures now, not due to any other causes. Of course, this will take the tally down. But China is going a step further. It says there's no death tally for Tuesday. From zero COVID, it seems to have gone to zero deaths. What's worse, China's foreign ministry has hinted at enhancing cross-border travel. It says it will provide more convenience for cross-border people movement in response to the times and the situation. Listen to this.
Over the past 3 years since the outbreak of the COVID-19 pandemic, we have adhered to a balanced approach and win-win cooperation, taking the lead in resuming work and production worldwide, actively promoting a high level of openness, facilitating the movement of people through arrangements such as optimizing visa policies through fast-track channels.
What does this mean? On one hand, China has stopped reporting deaths. On the other hand, it's talking about making travel convenient. Now, I don't want to sound like a conspiracy theorist, but does China deliberately plan to infect the world again? I know it sounds politically incorrect, but Beijing's track record always raises doubts. Thankfully, the world is now able to see through Chinese propaganda. Let me show you a statement from the US State Department. It says it hopes to see China defeat the virus soon because it doesn't want to see deaths anywhere. Exact words spoken. Listen in.
The United States joins the rest of the world in hoping to see the PRC defeat this outbreak and to get COVID under control. That, of course, is the case because we don't want to see death or disease spread anywhere. We also know that whenever the virus is spreading anywhere widely in an uncontrolled fashion, it has the potential for variants to emerge. We've already seen firsthand the cost of variants that have mutated and that have spread around the world. But third, we also note that what happens in China does have implications for the global economy. And it's important not only for the PRC, but also for the continued economic recovery of the international community that the PRC is in a position to get this outbreak under control. We believe in doing so.
The warning is timely because COVID cases are rising across the world. Just look at this map. As I speak, infections are surging in 5 other countries: Japan, South Korea, the UK, the United States and Brazil. Let's now look at how they're faring one at a time. I'll start with Japan. According to reports, it has logged more than 1 million new cases in the past week. 1,046,418 new cases to be precise. And by prefecture, Tokyo is the worst hit. It has logged the largest weekly number of cases. Next up, we have South Korea. As of Monday midnight, the country reported more than 87,000 new cases. This was the highest daily tally in 97 days. Health officials are predicting a resurgence in the days ahead. A report in the Korea Times says that medical experts have asked the government to prepare for new COVID variants from China. They further added that if a new variant emerges, Korea will be one of the first countries to be affected. This is mostly because of the country's proximity to China. In Brazil, the situation is no better. Reports say the country is facing its 5th wave and the 3rd wave this year alone. Last Saturday, there was a 302% increase in infections from 2 weeks ago. In the United Kingdom, there has been a 27% spike in hospitalizations in a week. The government has identified more than 20 new hotspots. Experts say the country is definitely in the grip of a new wave. In the US, the states of California, Texas and Florida are reporting new cases, and reports say that the Omicron subvariant BQ.1 is behind this spike. It gets worse. Besides a spike in COVID-19, health officials are warning about a tridemic. They say it could engulf most of Europe this winter. But what exactly is a tridemic? Well, in simple terms, it is a triple threat of COVID-19, influenza and RSV, the new kind of virus that we're talking about. 2 weeks back, there were reports of a tridemic overwhelming the Canadian health system too, with hospitals recording an unprecedented surge in the number of patients. The horror doesn't end there. In the UK, another virus is going viral. They're calling it the scarlet fever. It has infected more than 30,000 Britons. The virus is mainly caused due to a bacteria, and it triggers flu-like symptoms like high temperature and a sore throat, very similar to COVID. It gets worse. There's also a bird flu outbreak in Europe. Farms in more than 37 European countries are in its grip. Millions of birds are expected to be slaughtered in the days ahead. Why does all this matter? What will you call this current situation? What exactly are we in the grip of? A pandemic, a tridemic, or a septidemic? My point is simple. Besides the Wuhan virus, there are so many other viruses going around currently that it's hard for one to wrap their head around them and understand what on earth is going on. That said, the priority right now should be the Wuhan virus. It's back, it's spreading, and it may just be mutating. Plus, the surge in cases of other diseases would make combating the Wuhan virus tougher. So how should one navigate such challenges? What should you do? What kind of precautions should we all be taking? What kind of protocols should governments be implementing? To understand all this, I earlier spoke to Dr. Isaac Bogosh. He happens to be an infectious diseases physician and scientist, a public health and global health expert. I asked him, how does he perceive the situation in China? How should one navigate these challenges? What should be our protocol? How should we proceed as we head into 2023? Listen to his advice.
We see images out of China and some reports out of China demonstrating more widespread transmission of COVID-19. We've seen some images and reports of hospitals and healthcare systems already starting to feel the pressure of patients presenting with COVID-19 symptoms. And we know what COVID-19 can do to healthcare systems. We've seen this play out time and time again throughout the pandemic. I think one of the concerns is, are there more opportunities now for variants of concern to emerge and spread? And the answer is yes, there certainly are. We know that nothing happens in a vacuum. We're all intimately connected to one another on this planet. And of course, what happens in one part of the world can affect the other part of the world in a matter of a day or a couple of days. On the other hand, I mean, I think it's fair to say that we are still in the Omicron era. Many places have access to vaccines. And while the vaccines may not do as much as they once did in terms of protecting against infection and onward transmission, the vaccines still do a remarkable job in terms of protecting people against more severe manifestations of the virus, such as hospitalizations and death. We know that putting on a mask, especially in an indoor environment where people congregate in sort of closed or enclosed, crowded, confined settings, can reduce the risk of transmission and infection. Of course, it's not perfect, but it still helps a bit. We know that boosting hospital capacity and healthcare resources is extremely helpful as well. And we can create safer indoor environments as well by improving air circulation and ventilation to create safer indoor spaces. Not one of these measures is going to be perfect, but when you combine many of these measures together, you can take the edge off a wave and create a safer place, and also be able to care for a population better who are ultimately, some might need healthcare attention.
WION World is One is now available in your country. Download the app now and get all the news updates on the move.